Dr. Balakrishna, MCH Surgical Gastroenterologist from AIMS, New Delhi. I have a cumulative surgical experience of around 10 years with 6 to 7 years of experience in surgical gastroenterology. The topic for today's discussion is gastroesophageal reflux disease, commonly known as GERD or GERD, and gastritis. GERD and gastritis is one of the most common conditions which we come across in our daily practice, and there is a recent upward trend in the incidence of GERD due to the Western influence in our lifestyle. Common causes for the occurrence of GERD and gastritis include, it revolves around our eating habits mainly, and the causes include eating a heavy meal, eating a fatty meal, and eating excessive spice in food combined with lack of exercise. And contributing causes include consumption of alcohol, consumption of tobacco including smoking, and stress related gastritis. So what are the symptoms of GERD and gastritis? Majority of the patients with GERD and gastritis come with upper abdominal discomfort, which is commonly described as bloating. Patients have excessive burping, they can have heartburn, they can have chest discomfort, and they can occasionally have nausea and vomiting. The atypical symptoms of GERD and gastritis can include nocturnal cough along with breathing difficulty and throat irritation. Majority of the patients with GERD and gastritis can be diagnosed clinically, but often an office procedure known as upper gastrointestinal endoscopy is required for the diagnosis. This is a simple procedure wherein a tube with a camera at its tip is inserted through the oral cavity to visualize the lining of the esophagus and stomach, that is the upper gastrointestinal tract. The presence of any inflammation or irritation in the lining is detected, which can lead to the diagnosis of GERD and gastritis. So how are these patients managed? Again, the management revolves around anti-reflux and anti-acid measures. So patients are advised to cut down on heavy meals. Small frequent meals usually help. Patients should cut down on the consumption of fat, spice in their diet. Patients should cultivate any hygienic exercises habits. They should have a good bedtime routine. There should be an interval of at least 2 hours between meals and lying down. They should cut down on alcohol consumption and smoking. And for stress related causes, de-stressing hobbies such as gardening, simple jogging, walking should be cultivated. Along with this, anti-acid medications and prokinetics can be added for additional benefit. Very rarely, patients with GERD and gastritis require surgery. Severe GERD can be treated with fundoplication surgery, whereas complications of gastritis such as perforation and bleeding require surgery. I will be happy to answer any further queries on these topics. Please feel free to contact at United Hospitals, China.